Hello friends, welcome to my channel Doctor Online 24/7. Today I'm going to tell you about 9 signs of blood clots to be aware of. In this video we will be taking a look at 9 potential warning signs and symptoms of dangerous blood clots that may be present in your body. Your body naturally makes blood clots and dissolves them all day long. However, if they do not dissolve properly, they can become stuck wedged inside an artery or a vein, which can block the flow of blood to and from your heart. This can lead to life-threatening problems such as a heart attack, stroke or embolism. Symptoms of blood clots, and risk factors. Number 1. Walking cramps. One of the most common places for harmful blood clots to develop is within the veins or the arteries in the legs or arms. Especially if you smoke regularly, are overweight or are diabetic. If you notice a painful cramp-like sensation in the muscles of your legs when you walk, and the pain goes away again after resting, this indicates that there is poor blood circulation which could be caused by a blood clot. You may also notice swelling in the affected leg, arm and redness, heat in the sore spot if there is a blood clot. Number 2. Sharp chest pain. If you notice that you feel out of breath for no reason, with sudden sharp pains in the chest, or you have difficulty breathing, this could potentially be caused by an embolism in your lungs. This is a blood clot that has broken off from inside one of the deeper blood vessels in the body and traveled to the lungs, blocking the flow of blood. This is life-threatening, as the blockage will prevent you from getting enough oxygen in your blood. Number 3. One-sided numbness. If a blood clot blocks the flow of blood and oxygen to your brain, you will have a stroke. This commonly happens in people who have plaque in their arteries, which makes them more narrow and more likely to get plugged up by a clot. This causes sudden numbness or weakness on one side of the body, such as the face, arm or leg. You may become dizzy, struggle to speak or understand language, and have a severe headache because oxygen is not reaching your brain properly. Number 4. Basketball belly. Blood clots can get wedged in any of the blood vessels in the body. Sometimes they can obstruct the hepatic veins in the liver, which blocks the drainage of the liver, and prevents the organ from getting the oxygen it needs to function. This can cause fluid to leak into your abdomen, causing a hard, basketball-like belly which is tight, hard and swollen. Number 5. Arm pain. You may experience a heart attack if one of your coronary arteries gets clogged by either too much plaque or a blood clot. This causes severe chest pain that usually radiates down the left arm and the left side of the body, but can also happen in the right. You may also suddenly feel nauseous, lightheaded with a cold sweat along with the previous symptoms. Number 6. Loss of vision. Blood clots can also block the veins connected to the eyes, which often causes loss of vision in one eye upon waking in the morning. Or your vision in the affected eye may become blurry all of a sudden. Often there is no pain associated with this blood clot. You may also notice a dark area or shadow in the upper or lower part of your field of vision. This blood clot can lead to serious complications such as bleeding or swelling within the eye, so treatment is very important. Number 7. Irregular heartbeat. Another problem that could potentially lead to blood clots is a condition called atrial fibrillation. This is a type of arrhythmia where your heart beats too quickly, and also irregularly out of its regular rhythm, because of a problem with the nervous system. This can cause pooling of blood inside the heart, which can also travel to the brain, causing a heart attack or a stroke. Number 8. Swollen feet. If your feet and ankles become swollen, the skin becomes stretched or shiny, or you can leave a dimple in it when you press the skin with your finger. This indicates that there is poor circulation to the feet. Although this isn't always caused by blood clots, it can raise your risk of developing a blood clot, because poor circulation can cause the blood to pool in the veins, causing platelet activation. If you have this, it's important to bring down the swelling using exercise, B vitamins, and electrolyte minerals. Number 9. Varicose veins. Varicose veins are veins that become more noticeable on the legs. They may appear blue with a twisted appearance. This is a sign of poor circulation and a loss of tone within the veins, usually as a result of high estrogen levels. Varicose veins raise the risk of developing blood clots, where blood gets trapped within the veins, and it can also be a symptom of deep vein thrombosis. How to prevent blood clots. Let's take a look at some of the most important steps you can take to prevent these blood clots from becoming a problem. Number 1. Move your body at least once every hour, especially when you are sitting for long periods, such as working in the office, sitting on a bus or a plane. Stretching your legs and moving your arms improves blood circulation and reduces the chances of blood clots forming and getting trapped. Number 2. Take a daily supplement containing 100,000 SPU of serrapeptase, an enzyme extracted from silkworms. This enzyme helps to dissolve the fibrous tissue in blood clots, and thins out the blood to improve circulation. Number 3. Eliminate starchy, sugary, and processed foods and follow a whole foods diet such as paleo/keto. Focus on eating potassium and magnesium-rich vegetables like broccoli, Brussels sprouts, cabbage, arugula, bok choy, and leafy greens, to help support fluid balance in the body. Number 4. Stop smoking and drink no more than 2 to 3 cups of coffee per day. Smoking depletes vitamin C, which damages the veins and arteries, and too much coffee dehydrates the body. Start consuming at least 1 liter of mineral water to thin out your blood, and add 1/2 tsp of potassium citrate to improve heart function and prevent swelling. Number 5. Keep your blood pressure under control to protect the inner lining of your arteries against oxidation. Do this by getting regular exercise, keeping your stress levels low, taking rhodiola, herb, and eating nutritional yeast to supply vitamin B1. Number 6. Vitamins to dissolve your blood clots. That's it for today. Hope you like it. Thanks for watching Dr. Online 24/7 by Dr. Sana Bawani. Don't forget to like, share and subscribe my channel.